So for many of us who went to Oswego 20 plus years ago, oh man, it's a long
I
time
know
ago,
that's
guys.
I was doing the math today, Chris, and I'm like, oh my gosh, 22
It's a
years.
long, yeah,
That's
it's a long
horrible.
time ago, and even longer for those two. But but I'm not far behind. So
One
Oswego
year.
Health, yeah, I know. No one has to know that though. Oswego Health was pretty much just a hospital in the city
Yeah,
for when we were going to school.
yeah.
Uh, what is Oswego Health's footprint today?
Yeah, so we have currently 18 locations throughout Oswego County, and we are getting ready to open our first clinic in Onondaga County in March. So it's been kind of a strategic focus for us is growing. We often say, our primary service area, most of it is the lake, and fish
Mhm.
don't need healthcare. So in order to stay viable and independent, we have to look for additional patients elsewhere. So we've got recently, I think, since the pandemic, we're seeing more individuals coming north for healthcare, and maybe because of access. We've got, 6 different primary care locations. So again, we're providing that access. We have free parking, a lot of unique perks to, coming to our health system, but we've grown exponentially and I don't see us stopping. And our board is very supportive in us remaining independent. So we have no one governing us except for our board and our community. And that's what's great is that we can make real-time decisions. We can adapt to what our community needs, and we don't have somebody else outside of this community or outside of this state that's making decisions for us.
So has that been a conscious decision to not become part of a, large medical network conglomerate, so to speak, with all these other hospitals and doctors? And I feel like I know doctors that have said they've had to move on and go into these larger hospital networks to
Yeah.
stay alive at this point.
Yeah, I mean it's very competitive, and I think for those that survived the pandemic and that financial uncertainty, it's not easy. The math is not mathin' like in healthcare. It is very, very challenging to operate a nonprofit healthcare system in today's day and age, especially when insurance payers are not paying the rates that are completely reimbursable. And so the cost of healthcare for us and the rising costs of salaries, um, it's very challenging, but I think we are very financially critical of ourselves. And, we have a strategic plan, and oftentimes we have to say no to certain things because it does not align with where we're trying to go strategically as an organization. So we may shelf an idea until time, allows, but we're very, very focused. And, I think it's unique that we're independent, but our board is very supportive and does not want another entity to kind of gobble us up.